A major part of our patients' health depends on how effective their medications are. Our number one job as a home health and hospice provider is to keep our patients out of the hospital. The number one reason patients go to the hospital is due to medication errors. It is of utmost importance for us as licensed clinicians to make sure that the medication list matches exactly with what the patient is taking. It's the case manager's responsibility to make sure the list is correct and updated with any changes while the patient is on service with Aspire.
Hi Edna, it's Valerie, nurse with Aspire Home Health. Hey, I was wondering if I could come see you tomorrow at about 2 o'clock to do your home health admission. Okay, great. I'll see you tomorrow at 2. Can you please have all of your medications, including your over-the-counter supplements, any creams or oils that you use ready for me? Thank you. See you tomorrow. Okay, a big part of my job is making sure that you understand your medications, that you're taking them at the right time, and you understand why you're taking them and potential side effects. So we're gonna go through all of your medications, okay? Okay. It looks like these medications came from AccuPharm. Is that the pharmacy that you use?
Oh, mostly, but sometimes I use Smith's or Walgreens.
Okay, so I would recommend that you get all of your medications refilled from the same pharmacy. That way, we don't have any duplication of medications, and the pharmacist can review your whole medication profile to make sure there's no interactions and that all your medications are safe.
Oh, never thought of that. That makes good sense.
Anything you take for your bowels, sleep, essential oils, anything you take for pain over the counter, or supplements.
Yes, I take some Tylenol,
Okay,
and I started taking some fish oil,
okay.
and I like that essential oil stuff too.
Yeah, would you mind getting those for me so we can make sure we add them to your med list?
Sure.
Thanks.
So, okay. Just,
Yep, that's great, thank you. Okay. So it looks like this Tylenol's expired. Would you like me to discard it today?
well, you know what? My son stops by all the time, and I'll just have him pick me up a fresh one. So if you just leave it here, that reminds me to tell him to do that.
Okay, perfect. If you don't mind, I'm just gonna circle the expiration date to remind you that it's expired, okay?
Right here.
And you can toss it when you get your new bottle. On the fish oil, is this something that a doctor told you to start taking or something you've just been taking on your own?
Yeah, I kind of started that on my own. I heard it was really good for you, so I thought, try it.
Okay. So it looks like when you were at the hospital that they started you on Eliquis, which was a blood thinner, and the fish oil also thins your blood. So I'll need to check with your doctor to make sure it's okay that you take them both together. So if you'll just hold tight and not take this medication until I confirm with the doc that it's okay.
Okay.
Okay, I'm just gonna go through your medications here. And we're just gonna compare them to the medication list from the hospital.
Okay.
Are any of these new since you've been to the hospital?
Yes, they put me on blood thinner at the hospital.
Okay, I see that. It looks like you're taking Eliquis. Eliquis is a medication that you take to thin your blood, which is what we want so that you don't get a blood clot. But there's some things that I want you to watch for while you're taking this medication, okay? So it says to take it 2.5 milligrams in the morning and at night. So you'll take it twice a day. And then while you're taking this medication, I want you to watch for signs of bleeding. So bruising really easily, bleeding gums. So be really careful when you brush your teeth. When you use the restroom, I want you to be really gentle with yourself and watch for black tarry stools. If you were to get some bleeding on your gums or something like a bloody nose, and it lasts longer than 15 minutes, I want you to call home health immediately and then go to urgent care to get some further help, okay?
Okay.
All right, any questions about that medication?
I don't think so. I just be very careful to watch for bleeding.
Okay, and how often will you take this medication?
Morning and night is what I've been doing. I think that's the right.
Yep, that sounds great. Okay, We're just going to continue to go through your medications here. It looks like you're taking oxycodone. This is 325 milligrams. This is every 6 hours as needed for pain. A side effect of this medication is constipation. So it looks like you have Miralax here, and this is listed on your medication list to take once daily as needed for constipation. So I recommend that while you're taking this, that you also take the Miralax to prevent getting constipation unless your stools become too loose. Any questions about that?
No, that's clear.
Okay. I was looking here at your Lipitor, and it looks like on your medication list it says 20 milligrams and your bottle says 10 milligrams. Have you been taking 10 milligrams for a while?
Yes, that's what I take, 10 milligrams. I've been doing that for over 20 years.
Okay.
So I think that one's right.
Okay, well, I'm going to just double check with the doctor and make sure that's okay for you to continue taking the 10 milligrams since we have a discrepancy there. I see an oxygen concentrator over there in your bedroom, but you're not wearing it. Do you use oxygen?
Yes, I do 2 liters at night.
Okay, only at night then? Okay, perfect. I also see here that you have type 2 diabetes and you take insulin 3 times a day. Can you tell me what your last blood sugar was and how much insulin you gave yourself?
I believe it was a 114 and I think it gave 12.
Okay, I'm just looking here at the medication list with your sliding scale, and it looks like that's the correct dose. Would you continue to keep a log of your blood sugars for me until the next time I come, and we'll review those, and then we can make sure that you're staying within normal limits.
Okay.
Okay, I've updated all these medications to your list. Is there anything that we've missed?
I don't think so. Looks like I have a whole pharmacy here.
Yeah, it can be overwhelming, huh? Yeah, there's a lot. That's why I'm here, to help make sure that you understand what you're taking and when, and possible side effects to watch for and report. This is your completed medication list. I'm going to leave this here for you for reference. Okay, I'll just leave it here in your home health folder. And if you'll just keep it where we can find it the next time I come, and we'll review them again. But it's there for you if you need it, okay?
Sounds great.
Hi, Leslie. Is this Dr. Jones's office? This is Valerie, nurse with Aspire Home Health. Hey, I just wanted to let you know that I got Edna Thatcher admitted to home health, and I'm recommending that a nurse see her once more this week and then 3 times for the next 2 weeks. Physical therapy will also be doing an evaluation on her, and she has refused OT. I also wanted to clarify on her hospital discharge paperwork. It says that she's taking Lipitor 20 milligrams, but she has a bottle of 10 milligrams in her home. Okay, perfect. Yes, I'll make sure she's taking the 10 milligrams. I also want to double check. She's been taking fish oil daily, and she was started on Eliquis when she was discharged from the hospital. Due to the interaction of that medication with Eliquis, is it okay? Would Dr. Jones like her to hold that? Okay, I'll let her know to stop taking it while she's on the Eliquis. Thank you so much. Have a great day. Edna, how are you doing today?
Really well.
Good, good. Hey, I just wanted to follow up on a couple of things from our last visit. So first, the doctor said that he would like you to hold the fish oil while you're taking the Eliquis, okay? So let's take this out of your pill box and let's put it somewhere to remind you not to take it, okay? And then your Lipitor, he said it was okay for you to continue taking the 10 milligrams, okay? Excuse me, we're gonna pull your med list out here. Has your doctor changed any of your medications, or have you started taking anything over the counter new since I last saw you?
Actually, yes. My son got me some cough medicine because I
Okay.
was really having a bad cough the other day.
Okay.
And he also got me the fresh Tylenol. So
Awesome. Perfect.
I'll show you the cough medicine.
Thank you. Then I can get it added to your med list.
Yep.
Perfect. I'll get this added to your med list as well. Send it to your doctor so he knows what you're taking, okay?
Okay.
Anything else that's changed?
No, that's it.
Okay, let's review a couple things that we went over last week. We talked about the Eliquis. Can you tell me how often you're taking the Eliquis?
Every morning and every night.
Okay, and what are some of the signs you're watching for?
Any excess bleeding for, say, over 15 minutes.
Okay. Okay, perfect. And if you were to start bleeding for over 15 minutes, what are you going to do?
I'm going to give you guys a call and head to urgent care.
Perfect. Awesome. That's great. Let's talk about your diabetes. I see your blood sugar log here and everything looks like it's been going well. Would you show me how you check your blood sugar and draw up your insulin?
Sure.
Okay.
Let's grab this real quick.
Wow, it looks like you've been doing that for a long time. You comfortable with managing your diabetes?
Yes, I've been doing it a long time. I
Okay.
think I got that one down.
Right, good, good. Okay, I'm just gonna check your medications and make sure you don't need any refills, okay?
Sounds good.
This one looks like you've got plenty of this one. Oh, this one you're down to 5 tablets, so I'll leave this one out to remind you to get that one refilled, okay? And if this were a hospice patient, then I'd be calling the pharmacy to get that reordered for the family or for the patient. If I was in an assisted living facility, I'd be checking medication cards with the med tech to ensure that they had all the refills and medications that they need. Okay, and any other questions for me today?
No, I think we covered it all.
Okay, perfect. Let's plan a visit for next week and we'll review all of this again. But if you have questions in the meantime, you know my number's on your calendar. You give me a call, okay?
All right.
Thank you.
So much.
Hi, Edna. It's Valerie, your nurse with Aspire Home Health. Hey, I'm gonna be to your house in 20 minutes. Is that okay?
Oh, I'm sorry, you can't come to see me today. I'm actually at urgent care. I got a horrible nosebleed, and after 15 minutes, I came here to get help.
Oh no, I'm so sorry. What urgent care did you go to?
Mountain Point.
Okay, perfect. I'll get your medication list sent over there right away. I'll call in tonight and check on you. I hope everything's okay.
I'm doing fine, thanks. I'll talk to you later tonight.
Okay, bye-bye. Now I would call the office and report that Edna was at the urgent care and request that they send the medication list to the urgent care where she's at as quick as possible.
Make sure if you're at an assisted living facility and you have a patient there, that you tell the patient that you're going to the med room to check their medication list so that they know that you've seen their medications. And then go talk to the med tech and make sure the patient has everything that they need to get through the week. If there's any refills that they need on hospice, then you would reorder them. On home health, you'd make sure that the med tech was able to order those so that the patient will have them when they need them. And make sure when you go to the med room that you're actually touching the medication bottles, the bubble packets, making sure that the patient has the pills there. It's really important to actually look at the medications, making sure that there's enough. Thank you for taking the time to watch this video and learn more about how you can keep your patients out of the hospital by making sure that their medications are correct and keeping their information up to date.